A prisoner at the Lansing State Prison has died from COVID, making him the 23rd person in a Kansas prison to die from the virus. A Department of Corrections spokesman says this time it was a 90-year-old man with underlying conditions whose name has not been released. 5 prisoners and 2 staff members have died from COVID since the pandemic began. And as of Thursday, the Lansing prison has the second highest number of people getting COVID with 136. The Kansas State Prison at Norton has the most with 147, with over 1,200 cases total in Kansas State prisons. Area hospitals are doing what they can to keep people from getting sick from COVID, but KMBC 9's Alan Chope reports those hospitals are still facing a serious situation for those sick enough to be in a hospital without COVID.
Serious injury, cancer that needs inpatient therapy. All of those patients are suffering now because of the lack of hospital beds.
It's a problem that's hitting hospitals hard, but a possible solution.
It makes it quite a bit less likely that they will get sick enough to be put in the hospital.
The doctor's talking about manufacturers Merck and Pfizer's new oral drugs for COVID-positive patients to take within 5 days of starting symptoms. But the big issue right now,
there's a very limited supply.
The prescription-only oral medication, Paxlovid and Molnupiravir, are intended to keep the patient from getting so severely ill that they need to go to the hospital.
They inhibit the virus from reproducing, and so it basically just dies out.
University Health says the drugs are distributed much like the vaccine, shipped to medical centers.
The oral medications only work if you take them very early in the course of your illness.
Doctors say, of course, a vaccination is the best way to avoid having to spend time here, but they say the research on these 2 drugs shows that it helps keep patients out of hospital beds.
Proves the likelihood you'll stay out of the hospital.
The doctor says University Health, like other hospitals, have a very limited supply, but when those numbers start adding up,
well, in the long run, I think it'll be extremely good for patients.
In Kansas City, Alan Chope, KMBC 9 News.
Alan says if you want to know more about these drugs, talk to your doctor. Kansas National Guard troops will now help with COVID testing around the state of Kansas. Governor Laura Kelly deployed 80 Guard members to work at testing sites and deliver PPE for the next month. Similar measures stopped in Missouri at the end of December when Governor Parson allowed the Show Me State's state of emergency to expire. A federal team of specialized doctors and nurses are going to St. Louis to help hospitals care for people there. A 40-person team will report next week. A similar team has been helping at Research Medical Center here in Kansas City since the beginning of the month. They'll be here until February 4th. Kansas City, Missouri firefighters are also helping with a vaccine clinic to help people get protected from COVID. KMBC 9's Matt Evans has who else is helping.
Pretty good turnout for a vaccination clinic earlier on this morning at the Mattie Rhodes Center in northeast Kansas City. This has been a partnership between Kansas City, Missouri Fire Department, the Jackson County Health Department, and the Mattie Rhodes Center since last summer. They've been holding these vaccine clinics every Saturday since then. They've been able to vaccinate thousands of people all across Kansas City, and those vaccinations continuing today, along with booster shots being given out to dozens of people here at the Mattie Rhodes Center. For the Mattie Rhodes Center, this is all about giving back to the community that they serve. It's the same for the Kansas City, Missouri Fire Department.
This is a solution for us in a preventative and a proactive approach to be able to help people instead of us running those ambulance calls where somebody might not have had a booster or been vaccinated.
We're now in our 2nd century of community service here in Jackson County, and our charge is very simple, helping those most vulnerable and responding with a number of needs with social services.
The Saturday clinics here at the Mattie Rhodes Center with the Kansas City Fire Department continue from 9 to noon every Saturday for the foreseeable future. There's also weekday vaccination clinics the Kansas City Fire Department is hosting at the Mohart Center. That's at 32nd and Wayne every Wednesday and Thursday for the next several weeks as well. In Kansas City, Matt Evans, KMBC 9 News.
The FDA is extending use of the antiviral remdesivir for treatment of mild to moderate COVID. Authorization was given in May of last year when it was only for people with severe symptoms from COVID. Now, the FDA says it can be used for anyone testing positive who has mild to moderate symptoms, is not in a hospital, and is at high risk of severe illness. People can get it through NIV. The CDC continues to stress the importance of getting vaccinated and a booster. ABC's Lorraine Shaw says several new studies show the 3rd shot offers increased protection against the Omicron variant.
3 new studies from the Centers for Disease Control highlight the importance of getting a booster shot to offer the best protection against the Omicron variant. That 3rd shot reduces the risk of hospitalization by 94% when it comes to the Delta variant and 82% for Omicron.
These boosters are dramatically reducing your risk of ED visits, hospitalizations, and death. And even if people see these breakthrough infections among vaccinated, those are mostly asymptomatic or mild. So the impact really is in our unvaccinated population with far more cases, severe illness, and death.
A separate study finds if you are completely unvaccinated, you are 14 times more likely to be infected and 53 times more likely to die when compared to those who are boosted.
Protection against infection and hospitalization with the Omicron variant is highest for those who are up to date with their vaccination, meaning those who are boosted when they are eligible.
The U.S. recording over 18 million new cases in the last month alone, more than a quarter of the nation's total number of confirmed COVID-19 cases reported since the beginning of the pandemic. Yet millions of eligible Americans remain unvaccinated. On Friday, a federal judge in Texas issued a nationwide injunction barring the government from enforcing President Biden's vaccine mandate for federal workers. In a statement, the White House saying vaccination is our strongest tool against the virus. The Justice Department plans to appeal the decision.
The Biden administration says free N95 masks will be available at pharmacies and community health centers in the days to come, and the shipping of free at-home COVID tests from the government has already begun.